a delayed epidemic, and we've seen this in many contexts. We've seen how Italy, was one of the first countries in Europe to experience a large-scale epidemic, and it was followed by Spain, followed by the UK and others. And we believe that in that sense, Russia has experienced a delayed beginning to the epidemic and is now seeing that increase in cases. Russia has also increased its testing both in the urban areas and outside them, and the increased numbers may reflect partly that, but there's also been an increase in deaths, which means the disease is clearly having an impact. And I think the government has really shifted its response into a much more aggressive mode over the last week or so, because I think there's a growing realization that this disease is requiring a scaled-up response. In terms of the strategies been implemented, Russia has implemented fairly large-scale public health and social distancing measures. It is increasing its lab testing across the country. I think where all countries have struggled, quite frankly, is with systematic contact tracing, particularly when numbers begin to rise very quickly. And I think this has happened. If you remember, we spoke about the 4 C's before, where you have cases and you have clusters, and then you have this widespread community transmission. And I think when you have cases and clusters of cases, it's quite straightforward with some targeted investment in public health services to do the kind of containment activities we've spoken about before. Once you reach intense community transmission, it becomes very, very difficult at that point to do systematic and comprehensive surveillance. I think the exceptions to that are countries like Korea, that managed to do incredible contact tracing in the middle of a very intense community outbreak. So it is possible to do, but it requires a very coherent, very well-resourced and a very well-trained public health workforce with a lot of resources and the support of government and of the community to achieve that. And I think that's maybe for Russia, for other countries in Europe, once you get behind the curve and once the disease has spread at community level, the only options that have remained open to countries in those situations have been pretty severe public health and social distancing measures. And those measures have had an impact, and they have suppressed infection. But and as those numbers have fallen and restrictions are lifted, the danger is always, as Maria has said before, of a jump back. That disease will probably jump back unless you continue suppressing the virus by those public health measures, by those cluster investigations, by that contact tracing, that testing, and by continuing to support the community to maintain physical distance and appropriate measures, if not a total lockdown. With the case of the Russia, I think Russia is just in a different phase of the pandemic and can learn some of the lessons that have been learned at great cost in Asia, in North America, and in Western Europe.
Thank you, Dr. Ryan. Next question coming from Maya Plans from The Shift. Maya, you need to unmute yourself,